from those that I have seen that, from looking at surveys that we've done, who have choose not to vaccinate, it does limit you. You have to mask more, you have to stay home. A lot of people say, well, I'm just going to stay home while I'm pregnant. I'm not going to vaccinate. That's a personal choice, but it does limit your life and your lifestyle. So, that's just something to keep in mind.
Welcome to the Bronx Health Reach Community Coalition podcast. I'm Anthony Davis, who will be hosting the podcast. I'm a community health worker with Bronx Health Reach, a 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. For this podcast, we will be talking with folks involved in Bronx Health Reach's COVID-19 and flu vaccination initiative. Specifically, we will have a discussion with Dr. Eugene, Schiff, and Moria Byrne-Zaaloff. Dr. Eugene Schiff, Clinical Director, Adult and Childhood Vaccines, attending physician at the Institute for Family Health's Stevenson Family Health Center in the Bronx, and Moria Byrne-Zaaloff is the Program Manager of the CDC-sponsored COVID-19 and Flu Vaccination Initiative at Bronx Health Reach. Now, I do want to touch upon, wearing masks and staying safe. And ever since it was no longer declared a pandemic, COVID, now we see, or at least I see when I get on the train, bus, people not wearing masks, people not caring about social distancing anymore, even though COVID is still very much part of our lives. So, is it still necessary to wear a mask? Is it important to have them with you at all times?
There's definitely a fatigue related to COVID and mask wearing, and I think that played out earlier on in some places in the country than it did here in New York City, where you do still see a lot of people wearing masks and taking precautions on public transit, in the clinic, at least when people are coming in. And for us here, the Stevenson Family Health Center, federally qualified health center, and all of our health centers, we went back to wearing masks a couple months ago when the cases were rising in the wintertime. So we're still wearing masks, or it's a requirement for the employees in the health center to wear masks. So I'm wearing a mask, most days when I'm seeing patients the whole time, and it's just a way to protect others from spread. And it's something, I guess, as sort of like a community involvement and protection of the community rather than an individual, whatever is more comfortable for the individual. I think we should differentiate between the masks. So there's the N95 masks, which initially the CDC said nobody should wear those because they wanted to save those for the health workers, and then they came out saying that people should wear masks. And then there was the cloth masks and other face protections and eye protection. I think the level of risk is definitely dependent on the individual. So immunocompromised individuals, older people, have a higher level of risk. And so maybe that should be taken into account in terms of, wearing a mask, or if they can. And for others, in terms of wearing a mask to protect them. We may not go back to the initial days when we were wearing masks outside and we were wiping down our groceries. But definitely the role of masks can be helpful to reduce the spread in acute times. But during the times, I think we learned this from a lot of the Asian countries that where people were wearing masks even before COVID-19 came around, that it can be important in the wintertime during high rates of transmission to prevent the spread to others.
So you would say wearing a mask is still effective, and it will protect you, and if you're sick, protect others from getting what you have, if it not be COVID, then flu or RSV.
Definitely, and to protect oneself, the N95 masks, and then to protect others, the surgical masks or whatever masks can be done. Can definitely reduce the spread of airborne disease through coughing and having less particles around.
Right. Of course, I'd stipulate that by saying the mask isn't enough. You also have to make sure that, you wash your hands frequently, all the kind of great habits people have formed around being sick. I think we should keep those great habits, which are, if you're sick, stay home. If you're sick, make sure you social distance, or that you don't, spread it to other people. If you have to go somewhere, wear a mask and make sure your hands are clean. And some of the new protocol say that, we don't have to isolate after 24 hours if you test positive, but there's a lot of nuance around those instructions. So I really advise people to go and look at that information on the CDC website. It's very if then kind of. So it says like if you're positive but you have no fever after 24 hours, if your symptoms get better, then you can go back, after 24 hours about your normal activities. But, there's a lot of, what if you have a fever? What if your symptoms don't go away? So it's not just 24 hours across the board. You have to look at what's happening to each individual.
Are there certain foods we can eat that will boost our immunity to COVID, the flu, and other infectious diseases?
Eating a well-balanced diet, getting enough sleep, physical activity, these are all things that can help boost your immune system, but they can't prevent you from getting a virus. They can only prevent you from getting sick from a virus, is what I would say about that.
Which is pretty much the same as the vaccine. It won't prevent you from getting it. It'll just help you not be as sick as you would without the boosters, without the vaccine, right?
Yeah, I think it's part of many factors that contribute to, who's getting sick and who's dying from COVID. The obesity would have a 4 times more likelihood of hospitalization from COVID. So we know there's, an epidemic of diabetes, obesity in the community, and definitely higher rates in the Bronx than elsewhere. And underlying health impacts, at a lower age. So people may come in the Bronx at a lower age having diabetes, high blood pressure, high cholesterol, heart disease, asthma, or COPD on top of smoking. So the healthy foods, are critically important, but they're not always widely available or affordable. One of the largest things from SNAP, which a lot of people are on supplemental food assistance, but maybe using it for like soda or processed foods or sweetened foods. So definitely what we eat is quite important, and along with everything else, but it's not so easy in some of the places where there's a food desert or vegetables are so expensive that people have to choose between eating healthy or paying the rent. So that's something to take in consideration. But obviously the immune system is critical to fighting off infections. So anything that will decrease the immune system, including uncontrolled diabetes, high blood pressure, and some of the other effects of unhealthy foods will be something that we have that we're seeing. It makes it more challenging to treat COVID and more likely for people to be hospitalized when they're infected.
So would you say that it's important for a doctor to not only push being vaccinated, but also push for foods that would reinforce that vaccination and healthier lifestyle?
Definitely of critical importance. The way the visit is set up is we barely have time to talk about vaccination, and that's become a challenge, let alone like the more time outside of the 15-minute or 20-minute visit to go over diet and exercise and nutrition. So, but it is something that we're sort of encouraged and even reminded to do at every single visit, where we check a patient's weight and height, discuss the BMI, the body mass index, and healthy lifestyles. We have nutritionists in our community health centers who can provide even more information and more time. And we also have programs, including those by Bronx Reach, that have brought some community vegetable and community gardens and farm share. Maybe Moria can speak a little bit more about if she knows about that. But they're coming to our clinic at least once every week or every couple of weeks to bring fresh vegetables to the community to try to counteract some of the unhealthy foods that we sometimes see as being more prominently featured or more affordable.
Yes, so we have a food share program where people can pick up seasonal vegetables and fruit for a reduced price through, I think it's Corbin Hill.
Yes, I believe
and
it is.
Yeah, seasonal vegetables and fruit for a reduced price through, I think it's Corbin Hill.
Yes, I believe
and
it is.
Yeah, it's part of the food as medicine program, I believe it's called, and it's available to all patients as well as people in the community. And I think it's available at not just Stevenson, but another hospital in I think it's Walton, is also participating in this program.
So not only are you guys promoting vaccinations, but also the idea of eating healthier.
Absolutely, yeah.
Yeah, we previously had this thing where we would give to people like a prescription to eat fruits and vegetables, and then they would even get like a $5 coupon for the local supermarket here.
Mm-hmm.
I know that comes and goes with the different projects and funding, but the concept is still really important. So the more that we can do to promote healthy eating, and as part of preventative health, in addition to vaccines, it's both part of the same thing that can improve the health of the community and individuals.
So getting back to COVID and just these various diseases like flu and RSV, how can we differentiate between them? Because a lot of them have similar symptoms, and unless getting tested is the only way, we don't really know any other way of differentiating.
I mean, with COVID, you're more likely to have a cough. You're more likely to have the loss of taste and smell. That doesn't happen with the flu. In terms of the respiratory symptoms like colds and congestion and fever, there is some similarities there. But very typically the cough, you don't often get a cough from the flu. And I think, testing is important. You always want to test to see what you have. You may not have either of those. You may have RSV, you may have a cold, you may have allergies. I talk a lot about that. Some people think they have COVID, and it's spring, and they also have hay fever, or they're allergic to pollen. So it's important to get tested because it may be COVID, it may be something else, and you want to make sure that you're taking care of yourself if you do have allergies, and so that you don't have the combination of COVID or flu and allergy problems at the same time.
It's better to know for sure than to guess what you have.
Yes, absolutely.
Speaking of the different seasons, with it being colder during winter and even fall, does that affect the spread of COVID? Does it make it more possible for you to become infected with COVID or flu?
I think that's a tricky question to answer, but we do have a lot of data. There's data from October of 2022 through February of 2024, and we can graph out the times where there's actually like COVID-19, influenza, and RSV. And I don't think we can ever predict what's going to happen, this coming fall or this summer. But we have seen, typically like a rise in cases in the fall and like an increase until Christmas and New Year's, and then right after that. And it may correlate somewhat with being in school and also winter months when people are indoors and can easily spread. But there may be other factors as well, which is contributing to why one of these viruses pops up. So yeah, I had COVID in August, towards the end of the summer, and there was this spike of COVID from like July and August, and then it kind of stuck around and then went up again. And then, hopefully will come down now, during the summer months. But there's a little bit of an unpredictability of this, and that's one of the challenges for us and in health workers and in the public health agencies to figure out when is the best time to get a vaccine. You don't want to get it too early. And then, we don't recommend getting the flu vaccine in August for most people. Because then if the most cases for influenza come in February or January, then you may not be as protected as you were the month after getting the shot. So it's somewhat of a little bit of a guessing game, and there's definitely seasonal patterns. But if we look at the differences for the flu curve and the hospitalizations from flu over the last 4 or 5 years, each year is a little bit different than the year before. So it's hard to make generalizations, but definitely during the winter months, we can track these spikes that seem to have happened, especially with COVID, when we had the Delta and the Omicron. There's definitely huge spikes during certain times, often in January. Or December, where the cases are the highest. So it's something that, if anyone's interested, to go to the CDC website, where they can find the these graphs where it shows like how many cases there are now, what's happening in the wastewater. And then New York City and New York State will also publish that data. So anyone with access to, and unfortunately you don't have to pay, to get access to some of that information. So anyone can go in there and look and see which of the, which are spreading now. And we'd never know what'll happen tomorrow, but there is sometimes a seasonality to some of these infections. And we can definitely test in the clinic if someone's having a cold or a cough. I often will do a quick nasal swab, and there's rapid tests now that can be bought over the counter for COVID, and that can sometimes help us to determine if what virus, or if if it's another virus that we haven't, it could also be from a different virus, but it can also help us to say this is not a bacterial infection, you don't need antibiotics. This is why you're sick, and this is the recommendation, either to take an antiviral medication, or if it's been a certain amount of time since the symptoms came about and someone is otherwise well, to just rest and take Tylenol and fluids at home, and be on the lookout to not spread it to others. So for COVID vaccines, we're still recommending everyone get a boost, an updated vaccine if they haven't, and then for anyone over 65, if it's been 4 months since the last updated vaccine, to get a second updated one, or to get a first one if you haven't yet, which is the case for most people. But there may be some decrease in the response. You don't want to get it too late when everyone's already sick, and then it's not going to be of help. So it takes a week or two for the response to these vaccines. So it's kind of a guessing game, but we usually try not to miss the opportunity to give someone a vaccine if they're in the clinic at the right time.
One thing I would say is that when it comes to the summer months, we did see a couple of times in the past few years a bump or a spike of cases of COVID in the summer months when kids are out of school, going into camp, people are traveling, and I did see that people were trying to vaccinate before traveling abroad or visiting other countries, that was a big draw in the past few years in June, a pattern in terms of vaccination, not so much infection. But
thank you so much for joining me on this podcast, Dr. Schiff, Mariah. And if you have anything else to add, you can speak directly to the listeners now.
I mean, what I often say to people that seems to, I think, resonate is that, it's a personal decision. Vaccinating is a personal decision. What you choose to do with your health is a personal decision, and it's a choice. I've talked to people who have just had in one case, there was a woman who had her mother had just died. She hadn't planned on vaccinating at all. This was in 2021. And she came to one of our outdoor vaccine events and said, look, I wasn't planning on vaccinating. My mother didn't vaccinate. It was unexpected. We're trying to use an approach of just, natural immunity. But now I don't know what to do. And she didn't vaccinate at that moment. But, that is what I said to her. I said, this is a personal choice for you. And, this is an opportunity for you to get the information and think about it. You may not make the decision now, but, the best thing you can do for yourself is to get all the information so you can make an informed decision. Of course, we want people to vaccinate, but it's because that's what we do. We're in public health. But it's important. I think what seems to resonate with people is that they are taking control of their own health and making a personal choice. From those that I have seen that, from looking at surveys that we've done, who have choose not to vaccinate, it does limit you. You have to mask more, you have to stay home. A lot of people say, well, I'm just going to stay home while I'm pregnant. I'm not going to vaccinate. That's a personal choice, but it does limit your life and your lifestyle. So, that's just something to keep in mind.
I think I had a patient that I saw yesterday in the clinic who was initially reluctant to get the COVID vaccine, but then, as a caregiver, a home health aide to an elderly couple, she witnessed both of the people that she had been caring for almost for almost a decade, or even longer. Both of them died within 2 weeks of each other of COVID, these elderly individuals that hadn't been vaccinated either. So immediately after that, she came to me. She had gotten COVID, but she got the COVID vaccine and continues to sort of ask what they can do to stay up to date from the vaccines. But we would hope that it doesn't come to that point where we can try to understand how to communicate the value of preventative health, which is what the vaccines are. The mandates, were very controversial, but they did work when the city had them, at least for the initial COVID vaccines. The rates were as high in New York City as they were anywhere in the country. Over 95% of adults were vaccinated with the initial vaccines. Same with the children in school. You're not allowed to go to school if you don't have a certain, all of your childhood recommended vaccines. So there is a value of public health, but then also trust in your healthcare clinician and trying to reach people at the level where they are. I always offer patients the opportunity to come back if they're not ready now. And a lot of them do. Sometimes it just takes initial counseling, and then people will come back when they have time or when they're ready, or when it's a Friday when they know they might have to work the next day and get the vaccine. So we don't like to miss the opportunity, and the vaccines on the shelf won't necessarily help people as much as if they're in their arm. But I think there's a role for all of us to try to spread the right type of information and protect each other, keep our community safe. Some of that can be done in our community health centers, but that's just a small percentage of the people that are getting there. So the work that you guys are doing is so important. Bringing the vaccines, outside into the community. There used to be more mobile vans. This room where we're sitting right now used to be a large FEMA-funded Pfizer vaccination site. In addition, that was open to the whole community, and they were giving people $100 to get their vaccines, and there was lines out the door. So, sometimes those incentives, maybe especially for people who are older, 65 and older, most at risk, it might be worth bringing some of those back.
So if you want more information or you want to communicate with us, you can go to our website, institute.org, Vaccinate for Family, or you can call us at 917-999-4904. We also have a WhatsApp page, BX Health Reach Vax Champions. And that is a great way to send questions or communicate with us directly about if you need more information.
You've been listening to the Bronx Health Reach podcast with your host, Anthony Davis. You can email Bronx Health Reach at bxhealthreach@gmail.com. You could find Bronx Health Reach on social media. For Facebook, Bronx Health Reach. For X and Instagram, BX Health Reach. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health Reach podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health Reach and the Institute for Family Health.